From hard and soft contact lenses options to also eyeglasses and eye drops. Now, in myopia management, it's not just about picking which treatment to choose, but you want to do what's best for your patient and to suit it to their needs. You might want to consider things like their lifestyle, what they're going to be using it for, what are they comfortable with, are they okay with contact lenses, do parents feel comfortable with all these different options. So in this episode, I'm gonna be attempting to answer all of those questions in regards to the different myopia management methods. Hi everyone, I'm Shafiq. I'm an optometrist and I have been actively and proactively managing myopia here in Australia for the past 5 years and a bit. And I truly understand what it's like to be in your shoes, you guys who are really new to myopia management. It's really hard. There's a lot of information out there. So I just want to try to make it simple for everyone so that all of us will be able to manage myopia effectively. And also we know by the year 2050, half of the world is expected to be short-sighted. So let's try to do our part to bring that number down as best as we can. So I'm gonna just dive into the very first one. So the very first one is, in a way, one of my personal favorite for myopia management, which is orthokeratology, or also known as Ortho-K. So I would say that this is going to be best for those who actually do prefer an option that doesn't involve glasses at all, or they do not even want any daytime contact lenses in their eyes. So this is for those people who just want to seek that easy way out, in a way where they just need to sleep in the lenses at nighttime and then wake up in the morning, take out the lenses, and then done. They're good to go for the whole day, and then just think about putting the lenses back in when they need to at night. So I find that usually with this particular option, parents are the one who would also be making the decision for their kids, because they would see, are their kids able to actually handle contact lenses? And because they know the kids well in terms of maybe the hygiene, how responsible they are. And also Ortho-K is usually a pretty big investment, so they want to make sure that if their kids are in, they're really in for it. I have had some patients before. What I do is that I actually get them to try out some soft contact lenses, and then from being able to wear soft contact lenses, then parents see the confidence that their kids can handle lenses and are not afraid of them. Then they switch on to getting Ortho-K lenses after. So either way really works. And also we need to find someone who is very compliant with nighttime wear regimen. So what this really means is that kids usually are not going to find this much of an issue because they are going to be able to sleep at night. Now, however, just take note, for kids who maybe are not able to sleep too well at nighttime, this might not be like the best option for them. So definitely have a chat with parents as to see how well their kids are sleeping. So far in my experience, I only have had one patient. He was a 14-year-old boy who had this issue where, he wasn't really sleeping as well in a way. So his older sister was on Ortho-K and she was actually really happy with it. And now when it comes to the younger brother, we were considering whether we wanted to do Ortho-K or maybe consider a different option. And for him, we actually went for a different option other than Ortho-K. All right. Yeah. So just know that you have to see what works well for your patient when it comes to orthokeratology. The other thing also is that if they do get any dryness in their eyes with regular daytime contact lenses, yes, there is a workaround it where they can just use some lubricants or normal eye drops, and usually that itself will help to solve the issue. But we know and we understand that not all kids are gonna bring this small bottle of eye drops or even those minims, those that comes in a really small vial, with them every single time. So this might not actually that option might not work too well for them, and hence Ortho-K might be a better option. Now the next thing that's great about Ortho-K is that for those of them who are into sports, so if they're into sports, any contact sport, things like rugby, or even something like swimming, basketball, soccer, any of those kind of sports, I would say it's a good option to use Ortho-K in order for them to be managing their myopia and at the same time being able to be free of glasses. Now, let's talk about the nitty-gritty details in terms of prescription. Hey guys, real quick. So choosing the right type of myopia treatment option for your patient is of course very important, but let's not forget we must know how to effectively assess the myopia risk for our patient. And that is where my free PDF is going to come in handy for you guys out there. And you can just click in the link in the description down below to get it. In it, you will get a comprehensive list of in-room tests to perform, but you also get a history-taking questionnaire for parents to fill out, and you will also get a myopia risk assessment table where we'll be able to categorize our patients into low, medium, or high risk myopia, and you can decide whether you want to manage them or if it's worth referring them off. And yeah, doing all this, just link in the description down below, because this is how you're going to take your first step towards becoming a myopia management specialist. So what prescription would be best for ortho-K lenses? I would say anything that is above -2 diopters of myopia up to about a -6. Now, does this mean that anyone who's less than 2 diopters and above -6 diopters of myopia cannot wear ortho-K lenses? No, it doesn't really mean that. Like, they can definitely go on it also, but you just have to take note that if their prescription is a bit too low, sometimes you might not get as much flattening on the cornea, and also whether it will really benefit them in a way, it's hard for us to tell, because there are other options like the soft contact lens option, which might be a better option for them. And also, let's say if their astigmatism is more than -0.75 diopters, then ortho-K is a great solution, because ortho-K can both correct myopia and astigmatism. So it can correct two things at one go. Now, when you're dealing with much higher myopia, anything above -6, it is going to be a bit tricky, but it's not impossible. Personally, myself, I have had one patient who was a -10 with a -225 SIL. Now, it was a long process, and back then I was not as experienced fitting ortho-K lenses. It took us a good 4 months to get his lens to be great for him to be seeing 6/7. All right, so seeing 6/7 is actually pretty good. So overall, I would say that it is a very great option for our patients in a way that they are able to be free of glasses and to be not be able to wear daytime contact lenses, and also the fact that they do not have anything in their eyes, so hence the eyes won't feel too dry. Okay, so the other thing, of course, when we talk about ortho-K lenses, we also have to consider whether the corneal curvature is suitable for the ortho-K lens fitting itself. Someone with a slightly flatter cornea, and if they have a flat cornea plus a low prescription, is not gonna be the best for ortho-K in a way. Just because of the fact that if their prescription is too low and their cornea is fairly flat, how much can you really flatten it in order for them to get good visual outcomes? Now, there are going to be other options, other considerations also, like maybe the size of their pupil. So one good rule of thumb roughly is about if their pupil in dark conditions, I would say, if it's about roughly 6 millimeters, then they probably would be good candidates. If they have super large pupils, anything more than 6 millimeters in the dark, you might want to maybe consider some other options, because with ortho-K, because of the flattening of the cornea in the roughly 5 to 6 millimeters central of the cornea, that's where they're going to see clearly. If their pupils are way bigger, they might experience some glare or halos. So those are the considerations I would have for someone who would want to consider ortho-K. Now, next one, I would say for the MySight contact lenses. These are going to be for people who do want that glasses-free vision, but the thought of sleeping in a hard contact lens or even wearing hard contact lenses is freaking them out. So at least we know that this is still a very good option for them. The MySight contact lenses is a soft contact lens which pretty much works the same way as ortho-K in terms of the optics, where it causes that peripheral defocus and hence it slows down the axial elongation of the eye. So this is also going to be great for those who really do not have any dry eye issues with regular contact lenses. MySight contact lenses is going to be a good way for them to start. And when it comes to the prescription, I would say that for very low prescription, I usually like to start my patients on the MySight contact lenses. In fact, just a couple of days ago, I have had a patient of mine. His younger brother saw me when he was 8 and is wearing or have been wearing ortho lenses for the past 4 years. Now, the older brother, who's just a year older, who's now 13 years old, he just started getting myopia just in his right eye. His prescription was relatively low at just minus 0.50, and hence I was like, look, you know what? It's not really going to be worth it for us to do ortho K for him. So might as well, let's just start him off on my side. And mom and dad is also pretty happy with it. And also because like overall, in terms of the cost of the different lenses, my side is a bit more affordable compared to something like ortho K contact lenses. Now, my side contact lenses is also a great option for someone who is going to be willing to wear contact lenses and can tolerate contact lenses throughout daytime. We want them to be able to use these contact lenses for as long as they can during their waking hours so that they will get the most benefit out of the myopia control in a way. And of course, it's great. It has a wide range of prescription. Anyone below -2, I would say, because usually below -2, I would just recommend MySight instead of Ortho K because they will still get the benefit of the peripheral defocus. And of course, your astigmatism or your patient's astigmatism must not be more than minus 0.75. So anything that's 0.75 and lower, you can just do a spherical equivalent calculation and then you can fit the MySight lenses on them. But anything with -1 diopter of astigmatism or more, it would be recommended to go for a different myopia control option. For instance, like the Ortho K contact lenses. So that would be my consideration for the second one, the soft contact lenses or also the MySight contact lenses. Okay, now let's talk about a non-contact lens option treatment. So which is the myopia control glasses. These have been around for a while now, although it is still considered newer compared to the two other options that we have talked about. And I would say that, the lens companies have really done a very good job. And I am going to mention some of them. So the first one being Hoya with their Myo Smart lenses, Essilor with the Stellus lenses, and also Zeiss with the Myo Care lenses. So I think Zeiss is the one who's a bit late to the game in a way, but hey, it's never too late, when it comes to managing myopia. So it's great. I just love it that we have all these different lens option, and in a way, it all works on a very similar kind of theory of that peripheral defocus. But yes, so this is basically best for those who are like much younger myopes. The much younger myopes, I wouldn't really want to, categorize them, but maybe anyone who's younger than 8 years old, and parents maybe don't feel that their kids might be up for ortho K lenses or even normal soft contact lenses, then this will be a good option for them, because glasses is something that is really easy to use, but of course we must find the right type of glasses. So if I recall it right, with the for instance, with fitting like the Hoya Myo Smart lenses, you must fit the frame itself such that when it sits on the when the pupil is looking through the lens itself, there must at least be about 12 millimeters of clearance above the pupil and 13 millimeters of clearance below the pupil. So it's pretty much, if you think about it, like Harry Potter glasses, those really nice round ones. Yeah, those are going to be good for the Myo Smart lenses. All right, yeah, so again, those who just freaked out about contact lenses or parents are not as keen for the kids to go on contact lenses, glasses is going to be a great option. All right, and also, yeah, so as long as they are able to comply with wearing glasses, that's all there is to it. And also we have to consider like lifestyle options, such as are they going to be spending any time outdoors much with like exercise and maybe sports and activities? Because if they are, then you know what, it is still a good idea to consider a contact lens option. So for instance, I do have a patient who is currently wearing Myo Smart lenses and he's pretty happy with them overall. But then again, there are times where he maybe just once a week plays soccer with his friends. So that's where we actually got him just actually normal contact lenses. Yeah, so just normal, like if we can put it, single vision contact lenses, just for when he's playing soccer for a couple hours. After he's done with it, he take it off and then he's back using his Myo Smart glasses. So again, every kid is gonna be a bit different, and of course, also cost wise, it probably turned out to be a bit more cost effective because they are just buying the Myo Smart glasses one time, and then after that, you just use some normal contact lenses just when they are playing sports. And of course, there is going to be a bit of like parental involvement and support that comes into it. In fact, in all the different options also, but especially with the glasses, because with the Ortho K or with the MySight contact lenses, if the kids don't wear the lenses, they're not going to get good vision. So they usually would be a bit more compliant to put it on, especially if they can't see without those options. But with the glasses, sometimes a kid might maybe take it off, sometimes they might put it on, sometimes it might drop a bit off center. Now here's the issue, if it even drops a bit off center, they might not get the full myopia control treatment that we would want them to get. So just take note of it. With the glasses, it is a much more affordable option compared to the rest of the other options. But we must also consider the fact that it has to be fitted very well. All right, so let's talk about the very last option, which is the low dose atropine. Now, low dose atropine has been a really interesting kind of option because there was once upon a time, well, especially here in Australia, about 5 to 6 years ago, where almost every single optometrist was prescribing the atropine eye drops, just because for orthokeratology, we know that, optometrists have to kind of learn how to fit those lenses, and not every single practice might offer fitting those lenses services because you do need to get a topographer, and not all practices are gonna invest in one. And also back in those days, MySight and MyoSmart, sorry, not MySight, but I would say MyoSmart was still relatively new in a way. And also for MySight contact lenses, practitioners have to get accredited in order for them to be able to prescribe those lenses. Okay, yeah. So of course it's the same with the MyoSmart and all the different ones, but there was just a much more higher barrier back then. So atropine back then once was a really good option, if not maybe one of the only options out there back then. And it was always the talk about is it a 0.01 or is it a 0.025 or 0.05 percent in terms of the concentration of low dose atropine that we should be prescribing our patients. All right, yeah, so this is going to be suitable for maybe just patients, or I would say parents, who are a bit on the fence about myopia management, and maybe one of the main consideration for them is like the cost in a way. Yeah, so atropine eye drops is going to be a great option because it is not too expensive to start off with, and here in Australia especially, they can actually get the eye drop itself. They can actually purchase the drops once a month, so it might not feel too heavy on them in a way. Now, unfortunately, yes, with these days we have much better options to control myopia. Atropine is still a very valid option, but we definitely want to look at the other options also before we consider just atropine in a way. So atropine itself, nowadays, I would say not a lot of practitioners are going to prescribe 0.01% anymore, because as we know, the efficacy for it for controlling myopia is not as good as 0.025 or even 0.05% atropine, which now has a bit more research done on them, right? So but just take note that if patients do want to be on this, they have to be aware that there are going to be probably some minor side effects. So for instance, like photophobia, because the pupil is just gonna become a bit bigger due to the dilation from the atropine drops, and also sometimes they might have difficulty reading close up. But then again, it should not really affect it too much because they're still kids, they're young, and they can really accommodate really well. So most of the time, they would not have as much issues. But it's good to make parents aware of a few of these things, so not making parents feel like they're left behind, they can't afford the other options, but making them know that, hey, your child might experience this and this, but of course we can find ways to help them out. So with the photophobia, they can get photochromatic lenses, or even, if they're having issues really close up, that's why maybe getting like a multifocal glasses or bifocal glasses is going to be a great option, so that when they look down, they have a bit of reading addition in the glasses to help them to focus just a teeny bit better. Okay, yeah, so also atropine is still a very valid option for what's called combination therapy. So for instance, if a patient is using ortho-K lenses and they're still progressing quite a bit, there's a couple of things that we can do there. Firstly, when we order the new set of ortho-K lenses, we can maybe induce a bit more eccentricity in the treatment zone. Hence, we're just trying to, in a way, bring the light rays a bit more forward into the retina. But secondly, also, ortho-K plus low-dose atropine has been shown. So that is something that is really good to consider, that do not think that atropine does not have its place anymore. Atropine is still a very valid option for myopia control, and we should still use it. We should still use atropine eye drops wherever that we see fit. And last thing that I do want to touch about is actually about price. So price is something that is going to be an inevitable conversation that you are going to be having with parents in a way about, all these different options. I'll just give a bit of context. So here in Australia itself, ortho-K can range anywhere from roughly about $1,600 to $2,400. My side contact lenses, because you can buy it in maybe like 3 months supply at a time. So in a year, it probably costs roughly about $1,000. And then the Maya Smart glasses, for instance, now different companies charge it at a slightly different price, but I'm pretty sure you can get it anywhere from maybe five to six, seven, $800 thereabouts. And then lastly, the atropine eye drops can be purchased for about $50 a month. So that's roughly how much it costs here in Australia. Of course, price might vary a bit depending on where you are, which company that you go to, and also the maybe the myopia management package that your patients might be offered, or you might be offering your patients. Yeah, so this is something that is going to be a consideration. I have had parents who are really hyped up about the idea of ortho-K before, but when they heard the price in a way, they were just like, that's definitely a bit too much. Okay, so these are all the different things. Yeah, so these are all like the different things that we definitely have to consider in a way when we're thinking about all these different options. So that's what I'm gonna leave you guys with. But I really hope that I did give you guys some insights as to what would work best for your patients when it comes to either the ortho-K lenses, the soft myopia control lenses, the myopia control glasses, or even the low dose atropine eye drops. I'll see you guys in the next one. Hey guys, real quick. So identifying what's the best treatment option for your patient is very crucial. But let's not forget, we must know how to effectively manage or actually assess the myopia risk of our patients. And that's where my free PDF really will gonna help you guys out. So you can actually just click on the link in bio, because in this particular PDF, you're gonna get some history taking questions for parents to be able to fill out, some in-room examination tests that you need to perform in order to effectively assess myopia risk. High risk myopia, and you can see if you want to manage them or if you need to refer them off. So click on the link in bio on Instagram at Myopia Talks to take your first step to becoming a myopia management specialist.